Hello everyone, I am Dr. Manish Kumar Yadav, Senior Consultant, Neuro and Vascular Interventional Radiology at KIMSHEALTH, Trivandrum. Today I will be talking about aortic diseases which affect a large part of population. Why they are important? Because they are potentially dangerous and life-threatening. How these patients present? It can present with sudden onset of pain in the back or in the abdomen or in the chest. Once we reach the hospital, they are investigated by an echocardiogram or an ultrasound abdomen, and then a CT scan is performed. The CT scan identifies the abnormality of this aorta. What is aorta? Is the major blood vessel which carries blood from the heart to all the other parts of the body. Hence it is important because it carries large amount of blood. So any disease or abnormality in this, it's going to affect a large part of the body. Secondly, if this aorta ruptures, there is a significant blood loss which happens and it is most of the time fatal. So it's important to identify and treat any disease of the aorta before it ruptures. What are the various diseases which can affect aorta? Is aneurysm. The aneurysms are basically bulging into the wall of the aorta. It may be in the chest or in the abdomen. So hence the symptom depends on where the aneurysm is. Sometimes they present with change in the voice, which may be a sign of aortic aneurysm in the chest. What is the reason to treat? As I said, it is to prevent bleeding or rupture of the aneurysm. How it can be treated? There are predominantly two ways to treat aortic aneurysm. One is a surgery and second is an endovascular treatment. What is endovascular treatment? We take a small tube through the leg artery into the site of the aneurysm and seal the site of the aneurysm. So what happens? The blood flows through this specialized stent and then exits through the stent. And over a period of time, these bulges remodel and they become thrombosed and then they shrink over a period of time. What are the other diseases of aorta? Other diseases such as dissections. These are especially common in people with uncontrolled hypertension. They may have sudden onset of back pain, which may be a sign of dissection. Immediate treatment is the control of blood pressure. Once the blood pressure is controlled, the CT scan guides the further treatment. Once the aneurysm or the bulge or the dissection reaches a critical size point, they need to be treated. Or if they are associated with other complications such as reduced blood supply to the branch vessels, they need to be treated. Again, dissections, especially acute or chronic, they can be managed predominantly by endovascular route, by which through the leg artery we take a device or aortic stent graft and then deploy at the site of the dissection. What happens in dissection is basically the wall of the aorta splits and there is blood flow into both the lumens, which causes all the problems. And it needs to be treated to prevent rupture or other vascular complications. Thank you.